A heart attack, medically known as myocardial infarction, occurs when the blood flow supplying oxygen to a part of the heart suddenly becomes blocked. This usually happens due to the formation of a blood clot inside a coronary artery, which is responsible for delivering blood to the heart muscle. When the artery is blocked, the heart muscle does not receive enough oxygen and nutrients. Within minutes, the heart cells begin to die. If blood flow is not restored quickly, permanent damage occurs, leading to severe complications or even death. The most common symptom is chest pain or pressure, often radiating to the arm, neck, jaw, back, or shoulder. Other signs include shortness of breath, cold sweats, nausea, dizziness, and extreme fatigue. Heart attacks require immediate medical attention. Quick treatment opens the blocked artery, saves the heart muscle, and increases the chances of survival. Hi everyone, if you want to stay healthy and receive trusted medical tips, please subscribe to my channel. Your health matters. Early warning signs. Heart attacks often develop over time. Many people experience warning signs hours, days, or even weeks before the actual attack. Mild chest discomfort, a feeling of heaviness or tightness, unusual fatigue, feeling tired without any reason, shortness of breath, difficulty breathing during normal activities, neck or jaw tightness, discomfort that comes and goes, chest pressure during walking, known as stable angina, often ignored by patients. Ignoring these signs can be dangerous. Early diagnosis saves lives. Classic symptoms of a heart attack. 1. Chest pain. A central pressure or tightness in the chest is zero. Some describe it as an elephant sitting on the chest. Burning, squeezing, or sharp pain. Lasts longer than 5 minutes. Does not go away with rest or medication. C. 2. Radiating pain. Heart attack pain may spread to left arm or spleen, both arms, neck, jaw, abdomen, back/shoulder, kite, TP, upper abdomen, sometimes mistaken for acidity. 3. Shortness of breath, difficulty breathing even while sitting, feeling like you can't get enough air. 4. Cold sweats, pale, clammy, cold skin, body goes into a shock response. 5. Nausea, vomiting, stomach discomfort, more common in women and cases. 6. Extreme fatigue, sudden tiredness without exertion, yes, that 1000 and gazing, and begin days before the attack. Weaker. Dizziness, light-headedness or fainting sensation, feeling like the room is spinning. Atypical symptoms, jaw or back pain, nausea or heartburn, severe fatigue, mild chest discomfort instead of severe pain. Diabetic patients, silent heart attacks are common. No chest pain, only sweating, weakness or breathlessness. Elderly people, confusion, weakness, no typical chest pain. Causes of heart attack. Heart attacks usually occur due to coronary artery disease, where plaque builds up inside the arteries. Coronary artery blockage, plaque, fat plus cholesterol plus calcium, ruptures, blood clot forms, artery becomes blocked. High cholesterol, LDL, bad cholesterol, leads to plaque formation. High blood pressure damages artery walls, making them prone to blockage. Smoking thickens blood, damages arteries, increases clotting. Diabetes damages blood vessels, increases silent heart attacks. Obesity causes high cholesterol, high BP, and diabetes. Stress, sudden emotional or physical stress can trigger arterial tightening. Sedentary lifestyle, no exercise increases plaque buildup. Risk factors, age, men above 40, women above 50-40. Family history of heart disease, smoking or passive smoking. S. Diabetes, hypertension, high BP, high LDL cholesterol, obesity or big belly fat, lack of physical activity, chronic stress, heavy alcohol intake. Diagnosis in hospital. ECG, electrocardiogram, shows the heart's electrical activity. The first and fastest test, cardiac enzymes, troponin levels. Blood tests that confirm heart muscle damage. Echocardiography, echo, ultrasound of the heart to check pumping strength and damaged areas. Coronary angiography, a dye is injected into the blood vessels. X-ray shows where the blockage is. Doctors use this to plan angioplasty or stenting. Emergency treatment, immediate actions. 300 milligrams aspirin helps break the clot and restore blood flow. Oxygen therapy if oxygen level is low. Nitroglycerin to open blood vessels. Morphine for severe pain and anxiety. Hospital treatment. Angioplasty, a balloon opens the blocked artery. Stent placement, a metal mesh keeps the dot mesh. Artery open. Clot busting drugs, used if angioplasty is not immediately available. Time is muscle. Every minute of delay increases heart damage. Long-term treatment. Once the patient is stable, long-term management includes blood thinners, aspirin, clopidogrel, statins to reduce cholesterol, blood pressure control, ACE inhibitors, beta blockers, diabetes control, medicines or insulin betation, lifestyle modification, very important, regular exercise. As per doctor's advice, cardiac rehabilitation helps in full recovery. Prevention, you can significantly reduce your risk by quitting smoking immediately, maintaining a healthy weight or exercising at least 30 minutes daily, controlling blood pressure, keeping blood sugar under control, reducing LDL that I, cholesterol, eating a heart-healthy diet, low oil, low sugar, low salt, managing stress through relaxation, prayer, meditation, or breathing exercises, sleeping 7-8 hours every night. Prevention is always better than treatment. A heart attack is a medical emergency, but it is also highly preventable. Understanding early warning signs, managing risk factors, and maintaining a healthy lifestyle can protect your heart.